Setting: Hospital Accident and Emergency Department. You see a 35-year-old patient who has come to the emergency department with a burn on his foot which caused by dropping an iron box on it while ironing some clothes in the morning. You have just examined the foot before he sees the doctor. You confirm it is a superficial dermal burn. Now let's see the task. First one says confirm the presence of blistering and few white patches, and it is superficial dermal burn. Second one says find out if he has tried any remedies, cleaning or pain relief. Third one says find out if he has any signs of shock, dizziness, nausea or fever. Fourth one says outline the next step, examination by a doctor, dressing the burn, etc. Fifth one says explain the possible treatment for blistering, leave alone aspiration of fluid, removal of top layer of the skin. Advise that decision regarding the treatment will be taken by the doctor. Sixth one says advise superficial dermal burn takes 14 days to heal with minimal scarring. Seventh one says reassure the patient about the next step, prioritize case, pain relief to be administered, let a doctor to address concern. Now let's begin the role play. You can start like, thank you Mr. Joe for your kind cooperation to examine your foot. Based on my assessment, I understand the presence of blistering along with few white patches. It is a superficial dermal burn, which means it is a first degree burn that affects only the outer layer of the skin. But don't be overly concerned. This can be effectively managed with some treatment modalities. Before proceeding further, I would like to know a little more about your burn. Is it okay with you? Then interlocutor may agree with that. Then ask him like, first of all, what happened exactly on your foot? Then interlocutor may tell you like, nurse, it happened today morning. I was ironing my dresses and in the middle the iron box fell on my bare foot accidentally. That's how I got this burn. Then tell him like, I'm really sorry to hear that Mr. Joe. After the incident, did you take any measures to manage your burnt area such as cleaning or dressing it? Then interlocutor may tell you like, nurse, I was really scared after the incident, but I put some ice packs on my burn side and I covered it with a plastic wrap. Then I reached here immediately. Then ask him, okay Mr. Joe, did you take any pain medication to manage your pain? Then interlocutor may tell you like, yes nurse, I took a paracetamol to manage the pain. Then respond him, thank you Mr. Joe for sharing those details with me. Now let me explain to you the next step of the treatment. May I proceed with that? Then interlocutor may agree with that. Then tell him like, first of all, there will be detailed examination of your burn by the doctor. Then he may prescribe some treatment procedures which includes dressing the burn site. By the way, may I know if you have any signs of shock like dizziness, nausea, fever? Then interlocutor may tell you like, yes nurse, I was a little dizzy after the incident. However, I did not have any other problems. Then tell him like, okay Mr. Joe, I'm happy to hear that. Then interlocutor may ask you like, how are you going to treat the blisters nurse? Then respond him, your concerns are reasonable Mr. Joe. Let me explain to you that in detail. There are various treatment options that are available to manage the blisters. That is, if the blisters are minor, we may just leave it alone. Small blisters are usually healed on their own because the skin over the blister helps prevent infection while new skin forms underneath. Then if the blisters are major and fluid filled, then we may aspirate the fluid. Then we will remove the top layer of the skin and provide dressing to prevent the infection. However, the final decision regarding the treatment will be taken by the doctor. Do you have any more questions for me Mr. Joe? Then interlocutor may tell you like, how long approximately should I wait to get a complete recovery? And also let me know if there will be any scars on the bone side. Then respond him, your thoughts are reasonable Mr. Joe. Usually the superficial dermal burn takes almost 14 days to heal completely. However, there will be minimal scarring on it. But do not worry, this scar tissues fades over time. Okay Mr. Joe, do you have any more questions? Then interlocutor may ask you like, can I meet the doctor now? Then respond him, okay Mr. Joe, your concerns are completely understandable. As you know that this is an emergency department and doctors are currently busy with patients. They usually meet patients based on their priority. But don't be worried. I can assure you that your case will be prioritized and some pain relief medications will be administered. Then your concerns will be addressed by the doctor. So I request you to wait for the doctor. I hope you're willing to wait for the doctor until your turn. Then interlocutor may agree with that. Then tell him like, I appreciate your willingness to wait for the doctor Mr. Joe. Do you have any more questions for me? Then he may tell you like, no nurse, thank you. Then you can wind up by saying, okay Mr. Joe, I hope I have clarified your concerns and queries. I hope you understand that. You please be seated here for a couple of minutes and doctor will attend to you shortly. In between, if you have any more questions or concern, you can just let me know. I'll be glad to help you. Thank you Mr. Joe for your time. I wish you a speedy recovery. Thank you guys. Our roleplay and see you.